in fists and place your hands at his belly button, at the upper side of the belly button, and to move inward and upward, inward and upward.
如果发作患者失去了反应，我们将手移上来，放在患者的腋下，然后往后退一步，正好把它平躺在地上。
And then to help your partner to lie on the ground before performing CPR. Now you do this.
或者小朋友有不明白的地方，也可以问问我们老师。对，轻轻的，不要太用力哦。
If you have any questions, you can also ask our medical professionals.
这个是全眼的位置，然后全眼朝内，朝着我们肚子，而且是不能离开这个肚子。
Your hands need to move inward and upward.
通过这个冲击的方法，把这个气道当中
气道里面的异物排出。
This kind of impact can help the patient to get out of the to help the object of the respiratory system to get out. So if you want to help yourself, you can also use your hands and place them to the upper side of the belly button and move upward and inward. But in that case, the force might not be as powerful as someone else. So it's better to find help.
气道梗阻的解除手法，还有我们成人跟儿童，还有我们小朋友跟小朋友之间可以做的。那如果我们小朋友的力道比较小，我们一边做的时候一边尽量呼叫大人。
As kids, you might not be as powerful, as strong as adults, so you might want to seek the help of an adult. But there is a difference in height, obviously.
然后呢，这时候我个子比较高，我这样做就不好做。这个时候，我们施救者蹲下。
So when an adult is trying to help an adult, the helper, the responder, might have to squat before performing this first aid measures.
这是对于一个有身高差的儿童的气道梗阻，成人给儿童解除气道梗阻的时候的手法是这个样子。接下来我们来讲一下解除气道梗阻的有一个要点，我们刚才特别强调说，我们这个气道梗阻的时候。
Another important point is that when this patient is experiencing ingestion, the patient is still conscious. This is the Heimlich artificial resuscitation, artificial respiration. But if you arrive at the scene and the patient is already unconscious due to ingestion, and he cannot respond to your actions or your words, in that case, what should we do? In that case, we have to do CPR, that is cardiopulmonary resuscitation. It's different when you're performing CPR on an ingestive patient. Each case, if you're doing this, you have to open up the patient's mouth to check if the object is out. If the object is out, you need to use your hand to reach the object and take it out before continuing with your CPR. So the patient has to be conscious before you're doing a Heimlich CPR. So how to prevent ingestion? So preventive measures, as known to all, is more important than treatment. Mr. Xiao has bring us with a lot of goodies. This is the beans and some candies, which is very easy to cause ingestion in your daily lives.
首先，不要把不能吃的东西放在嘴巴里，
So first, you need to be careful about what you eat. We have seen a lot of reports. Sometimes the kid is choked by pencil cap, and it might also cause a very tragic result. So do not place small objects, your toys, the pencil, caps, into your mouth. And second is that when you're eating, please focus on your food and do not eat while you are doing sports. And also chew and to intake your food slowly, to chew sufficiently before you swallow. In recent years, we have a Xiamen marathon each year. One of the sportsmen is eating bread while he was running, and then he ended up experiencing ingestion. That is very important, not to eat when you're doing sports. So when you're experiencing ingestion, you need to first ask for help, and then ask someone to perform Heimlich measures on you ASAP. So as small kids, it's best to ask for the help of an adult if possible, and if necessary, call an ambulance. These are the knowledge about ingestion. Do you have questions? I want to remind you one thing. When you are eating, sometimes you might be watching TV, you're watching cartoons, and you might find something funny and you might begin to laugh, but that might also cause ingestion. So we're eating, for example, longyan or grapes, so you need to be careful. And also if you're eating sunflower seeds, it's quite easy to get stuck. The third is the bandage of trauma. How to stop the bleeding and how to do the bandage. We have some different types of bleeding, different types of trauma in veins and in artery. So artery bleeding, in the case of artery bleeding, there might be a large amount of bleeding. So artery bleeding, in the case of that, the blood is bright red, and there might be a very big pressure. So there's there might be like a spray or ejection of the blood, and in the case of a vein bleeding, the blood is of a darker color and the bloodstream is slower. And another case is the capillary bleeding. For example, nose bleeding. In most cases, it is a capillary bleeding. In a case of capillary bleeding, that is when you're cutting your hand or you're experiencing nosebleed, or you accidentally fell down and there are some bruises and you're bleeding. In this case, it might be capillary bleeding, and it might even be the bleeding might be stopped by just a band-aid. Now I can tell you, in the first two cases, how do you help the patient to stop bleeding? You can do that by simply using your the pressure of your hand, you might slow down the bleeding or stop the bleeding completely. So that's the first aid. Use whatever you have, and that is your hand. To use your hand to exert pressure on a patient. For example, in the case of head injury, in the case of head injury, the bleeding might be very big. So if there's a head injury, you can use your thumb to exert pressure here. You can almost feel the pulse here. That is the place of the artery. Use your thumb because it's the strongest finger. Use your thumb to exert pressure here at this point. And you can do this on both sides. You can use your hand to exert pressure, to give some pressure. That can effectively stop head injury, head bleeding. This is temporary, of course. And next step, when there is a head injury and bleeding, you have to use both hands to touch the pressure point here at your jaw. Yes, exert some pressure, and this can stop the bleeding at your head. This is how you stop the bleeding. Next, arm injury, arm trauma. This is how you do it. Place your hand at your arm, at the inside of your arm here. And also you need to help the patient to raise the upper arm. And then you can stop the bleeding by use your hand to cover the upper arm. You can almost feel the pulse of the artery. And this can effectively slow down the bleeding. Next part. If there's a hand injury, hand trauma, this is where the artery is. Now it's better if you ask someone else to help. And if someone else is helping you, they can use just your fingers. But if you're doing some self-help, you can use this two finger to go around your wrist. You can do it like this. Use all the strength you have to help stop the bleeding. Can help your deskmate do this. This can effectively slow down the bleeding and reduce the amount of bleeding. So that's the first aid. Now try practice this with your partner, with your deskmate. Okay, next situation. If your parents are cooking dinner and accidentally cut their hands, cut their fingers, the right place to exert pressure is here at both sides of your fingers. and then you can stop the bleeding before you find a band-aid to wrap around your parent's finger. So this is the place to press on each finger. It's the same for each finger.
对，很好。好，来，接下来哈，接下来我们来看一下，我们除了这个刚才说过的动脉行进按压法，只能暂时。
So beside artery
一边要干嘛呢？
bleeding, and after the first aid, you need to find a bandage because you cannot exert pressure forever. You have to find a bandage to act as a permanent pressure, permanent source of pressure. So at your home, we suggest that you have this prepare this bandage at all time in case of an emergency. So if you open up this package, there will be a triangular bandage. So if you do not have this at home, you have this at home, right? You must have this in your home, right? This is a regular towel. You can also use this to work as a bandage, but this has to be dry towel. Once we arrive at a patient house and the patient's family member use a wet towel to use as a bandage. You can also, that is wrong. And you also use scarf or even your pajamas. That is when you do not have a bandage at home. So now Mr. Xiao can be my assistant in this demonstration. So you're experiencing some arm injury, and now I'm trying to help you and raise his arm, and then use your thumb to give pressure here on your upper arm. Now I found this bandage. You can fold this and place here at the trauma, and then use your hand to wrap it, and then you can just tie this triangular bandage around the injury. Please tie the knot at the opposite side of the trauma and do not place it directly ahead of the trauma. That is how you do this. This is what we also call direct compression. Now can someone also practice this? Can someone volunteer? Any volunteer? Okay, who will be the patient? So you accidentally hurt yourself at your arm, and you saw this, and you can place your hand, lift your hand, and exert pressure here. Use this to wrap around the trauma.
然后从中间
Let's open this up.
然后呢，中间拎起来，然后再对折。
And fold it this way. And then you're ready to wrap it around his wrist.
这个手拿开是要在包扎的同时把它拿。
对，包扎的同时，所以说你速度要非常快。你这样，你这速度那么
You
慢
need
的
to
情
do
况下，
this more quickly.
就出很多了。然后呢，这样的环绕进行包扎就可以了。
Otherwise, there might be a lot of
但是好，来，请小
bleeding.
朋友下去来。但是呢，有
Thank
一个
you.
要点就是我们刚才说的，首先我们这个刚才那个小朋友选的是一个小的敷料，我们尽量选的时候按压在上面的这个棉块，尽量大块，尽量大块，但是要把它折叠起来。然后这个时候
This
回档的时候它有一个
wrap
按
need
压
to
的作用。
be
所以说
bigger,
尽量选
and
大
then
块
the
的敷料，
pressure
先把
needs
它
to
对折，
be
然后压在手上，
stronger
然
in
后你再
order
加
to
上你的外
stop
面
the
的这个
bleeding
三角形进行敷
effectively.
料了，进行往下用力捆绑包扎的时候，它有一个挤压的作用，它可以压迫止血，然后呢使局部的
So
这个
this kind of
止血可以
pressure
完
can
全的就可以
stop
止
the
住。
bleeding
但
or
是
at
有个
least
要
to
求就
slow
是我
down
们
the
这外面
bleeding.
这个包布一定要
But
比较
one
大，
thing
要
to
把这个敷料
remember,
完全的包
this
住。
has to be
这
big
样呢
in
要
order
立
to
住。
cover
还有一点
all
就
of
是
this
我们
materials
打结的这个位
inside.
置一定是要不要在伤口的正上方，因为大家都知道伤口
And the
一
knot
打你在上面还用力的打结，那下面就会更
And
疼了。所以
the
说我们
knot
在
should be
伤
at
口
the
的背面
opposite
进行
side
这
of
个
the trauma,
很
otherwise
深
it
的
might
一个打结
cause
的
a
方法。然后
pain
呢，还有
on
一
the
个要点就
patient.
是，如果我们绑得非常紧，这个久了，这个患者的手开始发麻了，
If this
我
is
们尽
if
量
you're wrapping this too
是把它
tight
紧紧地
and
松开一下，
the
然后再轻
patient
地把它
might feel numb at
这个
his
是一个
hand,
要点。
and then we can lose the knot
因为
for
如果说
about
你
10
长
to
时间的这个
20
手，它
minutes.
这个血流完全阻断，有的男
Otherwise,
孩
it
子
might
力气非
stop
常
the
大，
bleeding
然后扎
for
很紧，整个手都
too
变紫色了。
long
因为长时
time.
间的捆扎，它会导致
It
这个
might
上面的这
also
个端会坏死。
哦，
所以说
cause
对
some further
而不利
injuries
于恢复。所以说，如果扎得非常紧的时候，
at the
那你
nerve
就是
of the
10到
hand.
20分钟松开一下，然后让
So
它血流
every
恢复
10 to
再扎。
20 minutes, you
同学们要记
can
住啊
lose the
但
knot.
是小朋友的力气一般是扎不了很紧的。
But I don't think you're all that strong enough to do that, so
我们刚才
just use all the strength that you
这个
have
肖
when
同
you're
学
doing this.
做过了一个鼻出血，鼻出血。
Mr. Shaw also mentioned about nose bleeding. So do you have some
鼻子非常
experiences?
容易出鼻血。
When I was young, I was quite easy to nosebleed.
但是从小到大，很多人教过我不一样的方法。有人说是用冷水来敷，
Someone told
然后拍
me
打
that cold
有人
water
说是
can
举
help
手
to ease the situation. Some of them helped me to raise the hand. I don't know what is the correct way. So when you're experiencing nose bleeding, the correct way is to sit at your chair, lean forward, use your hand, use your two fingers to exert pressure here, and also you can use some ice cubes to help.
并不是说家里的爷爷奶奶说鼻出血了，赶快把头抬起来，把头抬起来。
So the incorrect ways would be raising up your hands. That will not help stop the bleeding.
那如果大出血的情况下，非常容易造成什么卡血或者异物梗阻，然后
And might also cause some coughing and also respiratory conditions as well. So this is the correct way to use your two fingers to exert pressure at your nose beam. So that's all for today's first aid lessons. Hopefully you can also learn something, learn more about first aid knowledge, and that will be
好，那我们最后把
quite
掌声送给温
significant.
老师好吗？
Thank you, Ms. Wen, for that informative
是
lecture.
的，非常感谢温老师给我们带来了这个1个小时的
Thank
这
you,
样
Miss
的
Wan.
一个急救知识的一个普及啊。那小朋友可以下课了，谢谢大家。
And that's all for today's lesson. And you're dismissed.
其实这40分钟的这个课程很快就过去了啊，在这一堂40分钟的课程
I
当中
think
呢，
this
我也
40
是
minutes
受益匪浅，
passed
学到了
really
很多这个
quickly.
急
I
救的一些
personally
知识。
learned a lot.
其实不仅是对于同学们来说，这个急救常识
So
的
not
普及对于
only
我
are
们每一
those
个人
knowledge
掌
useful
握
for
必
the
要的急
kids,
救
but
常识在
also
关键
for
的
the
时刻真的
adults.
能够
It is necessary for
挽救
each
一条
patient,
生
to
命。
each
其实
adult,
我们平常
to
呢，在很多的
also
新闻报道当中
master
都
some
能
of
够
this
看到
knowledge.
一些患者
And
因为
in
得到了
some
及时的
condition
救治
in
转
my
危为安的消息，这
in
样的一
my
个故事。但是不得不承认的
save
是，
a
的确
life.
还存在
We
很
heard
多
a
人
lot
出
of
现这种
successful
极为
stories,
重突发
people
极为
with
重症
first
或者
aid
出
knowledge
现
to
意外
help
伤
save
害的
a
时候，
life.
因
But
为身边的
also
人没有
we
掌握
heard
急
a
救
lot
常
of
识，
tragedies
失去
when
了活着的
emergency
机会。
happen.
那
People around
其
this,
实我们
people
在
around do
日
not
常生
have
活当中
necessary
经常都知
skills,
道，比
so
如说像是心
a
脏
life
骤
is
停，
lost.
出现这样的极为重症，
We
那黄金抢救时间呢只有仅仅
also
4到6
seen
分钟。如果在这4到
that
6分
when
钟
this
当中
patient
呢，
is
一旦出现这个事件，有
experiencing
人第一时间拨打了
a
120，
heart attack,
那么医护人员赶
the
到现场
golden
仍然
first
是
aid
需要一段时
period
间，而
is
且
only about
几
4
乎
to
是
6
很难在
minutes.
这4到6分
So
钟
you
的时候
must
就赶到现场。
perform
那这一段时
first
间呢，
aid
刚刚其实一开
before
始的时候，温老师
medical
也介绍到了，
professionals
这叫做医
arrive
疗
at the
急救的
scene
空窗
in
期。
an
这段
ambulance.
时间当中，如果现
So
场
at this
有
period
人
of
能
time,
够掌握这种必要的
if
急救
someone
常
at the
识，对于
site
挽救
can
生
master
命来说，
some
包括
of this kind
生
of
命
knowledge,
提升这
it
个
might
抢
be
救的
quite
这个成
useful
功率来
and
说
might
是
also
必不可少的，也是非
increase
常
the
重要的。
successful
所以
rate
今天40
to
分
save a life.
是给孩子给我带来很多这种急救常识
So
的普及，
this 40
也是希
minutes
望
is
能够
highly
给正在收
significant
看
for
节
the
目的
kids
各位
and
朋
I
友们
believe
给
for
您一些
me
启示，
and
要
all of
注
the
意留心
viewers.
身边，或者是有意识的去
So
学习一些急救常识。相信呢，
It's
在关
necessary
键的
for
时
all
刻
of
呢，
us
就
to
能
learn
起
some
到
of this
关键
first
的作用。
aid
好的，今天我
knowledge.
们的直播呢到这儿就结束了，非常感
That's
谢
all
各
for
位的
today's
收
live
看。
stream. Thank you for watching.